And we've asked one question: is there an organization that is working across the spectrum of drug policy to say, this is what's working, these are the reforms we need, let's take a complete big picture perspective, what do we need to encourage in our country from the federal level on down? And the answer was a resounding no.
People don't organize around mental health the way they do cancer and heart disease and all other illnesses. Not surprisingly, payers are very lax in following the law, and unfortunately our regulatory system, or through our administrations in the past, have not really had this as a priority. Obviously, since the pandemic and the increased suicide rate and overdose rate in this country, this is of paramount interest. We have longer life expectancies, except for the fact that our deaths of despair are actually forcing down average life expectancy for all Americans. So we have to do something, and it requires a multi-pronged approach. And enforcement of the parity law makes a big difference because it means less barriers to people being able to access mental health and addiction services. Basically, the parity law says you cannot treat mental health and addiction any differently than any other physical illness.
We are designed to create a blueprint to currently deal with the opioids, again, to educate all communities. A lot of times you don't see people of color, Black and brown communities, who are being most impacted not really being a part of the solution. So part of the solution is to educate, to empower people, and give them the necessary tools that they need to overcome this addiction.
The Foundation for Drug Policy Solutions, national organization. We are going to be taking on all these drug policy issues, scaling up what's working, because there's so much that's working in places all across our state, all across our country, and we want to scale those things up. And that is what the Foundation for Drug Policy Solutions is about. Today we actually had a soft launch of our website. It's just gooddrugpolicy.org. We're about good drug policy. We know that there's a lot of things that work out there that we can't ignore. We know that drug treatment courts work, but that's still a boutique program. It should be implemented everywhere. Anyone in the justice system with a drug problem should have access to treatment. Treatment has got to be easier in this country to get than drugs, and right now it's not. And I completely agree with the mantra that we need to meet people where they are, but we have to go further than that. It is not just meet people where they are, it is meet people where they are, but don't leave them where they're at.